Hello and welcome to our webinar this afternoon. Thank you all for joining us today. My name is Helen Woldab and I will be moderating this webinar. Before we actually kick off the webinar, I want to share a few housekeeping notes. Please know that the recording will be shared with you after the webinar is over. And if you have any questions, you can use the Q&A box located below. And if you actually want to share resources or just have general conversation or even communicate with us, the speakers, you are welcome to do that using the chat box. So with that, I will turn the mic over to John Gillespie, our VA or Laerdal VA specialist.
Thank you, Helen. Thank you all for joining the webinar today. I'd like to take just a second and introduce the folks that are supporting us with this. Dr. Penny Watts is in the School of Nursing at University of Alabama, Birmingham. And Dr. Watts was a past chair for writing the standards of best practice and is intimately familiar with them and among the many other hats that Dr. Watts wears. Additionally, we have Matt Charnetski with us. Matt is, he has a very interesting background. He joins us from Dartmouth, and he has done simulation in some of the most amazing places on the planet, everything stretching from Antarctica to the Netherlands. Matt has an amazing background. He's working on his PhD in health professions education, focusing on simulation curriculum transfer and cultural competency. He's currently working on that in the Netherlands. Next slide, Helen. Thank you. So today's topics, we've just introduced everybody. This is going to be an interactive presentation. So we really would like for you to join us in the chat as we move through all of these objectives. We found in the previous one that we did, this is the second in a series, that the more interactive it was, the richer experience it was for those of you attending. So we encourage you to exercise the chat feature. We will be monitoring it, and we'll jump in as the questions come in. Thank you, Helen. And so with that, we're going to start with a poll. So what are you hoping to gain out of joining this webinar today? What is it that you're hoping to be able to have as a takeaway? If you would, please put your responses in the chat box. And if anybody is struggling with the chat box, please raise your hand and we will try to help you as best we can. So while we're waiting on responses, Matt, what's the one takeaway that if you want your audience to remember moving forward regarding operations and simulation, what would that be?
You know, I think one of the biggest take-home points I try and offer people, or maybe whatever comes before a take-home point, the stuff that you eat when you're in the drive-through waiting for your takeout food, is that these standards are aspirational. And a lot of times when we think about standards, we think, oh, this is the base. This is where we start. And so much work has been put into these things. And so many of us are at so many different stages of our careers, our centers, our programs, whatever it happens to be, that I think keeping in mind that this is what we're working toward. And so as we go through these standards and we look and see something or see something that we're not quite doing, it doesn't mean we're not doing it right or that we're failing. It really means that either we need to look at that standard or that criterion and see, how does that fit with my program? Does it make sense? And how do I get closer to whatever it is it's asking? In the accreditation world, we often say, if you've seen one sim center, you've seen one sim center. And you know, everyone is coming up with really remarkable solutions to these different problems, and everybody's organization looks different. So keeping in mind the spirit of these things and how we apply them is probably the most important thing that we can do.
Helen, we have one person that has raised their hand here. Joe had raised his hand.
Excellent. Can you click on Joe. I'm trying to find that.
Joe's about 2/3 of the way down on the list. Attendees.
About
it looks
2/3
like
way down, just like McBurney's point.
No, we see your hand raised or was raised, and we're trying to figure out how to get the floor to you.
Yeah, and it looks like the chat is disabled for some reason, and we're going to work on fixing that as we kind of go through this, because we do want you to share your feedback. But in the meantime, please feel free to just drop it in the question and answer section. And Joe, yeah, I see your comment that the chat is disabled. Thank you for dropping that in the question and answer section. So yeah, feel free to drop your comments in there, and we will go from there until we can get the chat enabled.
And
Sorry about that.
Yeah, Augusta Hernandez also responded self-improvement. Also good area to focus on with operations. All right,
Perfect.
with that, let's go ahead and dive into the presentation. The floor is yours. Thank you, Matt.
Thanks. I'm going to just defer to Penny and let her take it from here. Just kidding. I'm just kidding. So hopefully some of you were able to make it to the last webinar. Hopefully you're able to make it to the future webinars as well. But we do like to offer a little context for all of this. So the healthcare standards, healthcare simulation standards of best practice are something that have been worked on, reiterated, developed, and grown over the last, what is it, Penny, 15 years, give or take? And to that end, we've come up with these 10 standards that cover really the gamut of a simulation program and the content of that program. And so there's simulation design, professional development, interprofessional education, professional integrity, pre-briefing, facilitation, debriefing, outcomes and objectives, evaluation, and today's topic, operations. And all of these things kind of feed off of each other and interrelate in a lot of ways. So for instance, Augustine, I saw that you had talked about self-improvement. We'll touch on that a little bit today. Professional development as a standard is also something that I think you'd be interested in. And so seeing how these interrelate and how we can apply these is really important. Next slide, please. When we break down those 10, there are the core 4 standards, and Axel has recently started an endorsement program that certain sim programs can look to sort of validate and verify the content of what they're delivering, their curriculum and the work that they're doing. And the primary focus of the endorsement is those core 4 standards, which are the debriefing process, facilitation, professional integrity, and pre-briefing or preparation and briefing. So understanding that those are the things that we kind of consider as the basis for everything else. It kind of flows out from there. So moving on to the next slide. You can see then that we have these 4 other standards. Now, in my opinion, the core 4, or excuse me, 6, I said 4. The core 4 are, again, kind of that foundational piece when we're looking at curriculum. Now, from my perspective, I came through simulation, as John said, in some pretty strange and twisty and turny ways. I have a lot of years of IT experience. I was a critical care paramedic for a long time. But really, my focus in sim and my role in full-time simulation work has been really predominantly focused on the operations side. So even when I move into education or I talk about research, I really am coming from that lens of the operations and administration side of the house. And so to that end, I think looking at these are the things that then enable those core 4 to really shine. So today, next slide, please. We'll talk about the operation standard and the 6 criterion that go into that. Now, as I mentioned in the beginning, these things are aspirational. So we look at these 6 criterion, and within these, there's going to be some wiggle room in terms of exactly what it means to meet these criterion and how that affects your center. And so what I'd like to do is go step by step through this and then just offer what I've done or what I've seen or what my experience has been on that criterion. And at the end of each criterion, we'll just pause for a second and see if anybody has any thoughts or questions or anything else. And you can put those things in the Q&A. So please don't be shy, pop stuff in there, ask questions, and we'll address them as they come up. Penny, anything you would add?
No, I think it's great so far. Keep going.
Okay. Good, good. So when we think about operations, a lot of times we tend to think about operations as the technical delivery of SIM. When we look at the operation standard, it's not just the technical delivery of SIM, but it's also all of the other operational, logistical, and administrative considerations that go around SIM. It's all those enablers that make it so SIM can work. It's the thing that actually makes SIM a really unique department in any university, hospital, healthcare system, whatever it happens to be, because it's the thing people don't think about. I'm kind of curious how many of you came into SIM through the clinical side where they said, you're a great educator. You seem like you're interested. There's a closet over there with a bunch of stuff in it. Why don't you go over there and poke around and see what you see? Go ahead and raise your hand and let me know if that happened to any of you guys. Wow. Okay. See, so we're starting to see some folks pop through there. I know a lot of people have had that experience. When I try and explain to people why we need to do something different in order to really be able to deliver SIM, a lot of times in my department, I happen to be housed in an educational entity within a healthcare system. So the first question they ask is, oh, great. So you need more educators, you need more facilitators. And I say, well, no, I need more techs, or I need this operational role to help support these things. And they say, well, but you're an educational thing. Like, you need more educators. Have one of the educators do that. Put it under their role. And I say, no, this is just it. SIM is just different. Yes, it is an educational modality, but in order to deliver that modality, we have to be able to do all this stuff. So criterion 1 on this standard is to implement a strategic plan. And this is something that we see in the accreditation work from Society for Simulation in Healthcare. It's also stuff that we see referenced kind of loosely through the endorsement program, because it's something that you don't know where you're going until you actually like map it out and talk about exactly where you want to go. And there's a lot of people who will tell you, oh, it should be a 5-year plan or a 3-year plan. Man, I'll tell you what, where I've been most of the time, just getting to a 1 to 2-year plan is a huge success. Other places I've looked at, they get a 5-year plan, they're able to stick to it and they follow it through. But with this, we just want to be able to kind of offer that warning shot to the program. Now, I don't know what level of organization each of you are at, right? If you're coming in as an operations specialist, if you're coming in as a tech or a senior tech, if you're an educator, if you're some sort of administrator, who your strategic plan feeds to is going to change. But you should still have one. And even I would argue from a professional development standpoint, you should probably have at least a little bit of a strategic plan. Where do I want to be in the next year, in the next 2 years? And putting that together and breaking it down into manageable bites and being able to kind of walk through that flow of what that looks like can be really important. I'm working on our strategic plan right now. It's massive. We're a relatively large department, even though we're a relatively small sim center. We're trying to serve a medium-sized, or actually the smallest academic medical center in the country, which still makes us fairly large. And we're the largest hospital system in New Hampshire, and I believe in northern New England as well. So we've got a lot of moving parts, which makes our strategic plan really big. Now, for the last 3.5 years, we haven't been able to have one because the world's been upside down, right? Every time we try and make a plan, they would be like, yeah, we can't because it's a new pandemic or it's a new thing or financial struggles or whatever it is. So we've had to be more agile. That doesn't mean, though, that we haven't been collecting things and making the plan we can. So for a long time, we had 6-month strategic plans. This is what we'd like to do over the next 6 months to keep ourselves afloat, to keep focusing on at least moving the needle forward. And now we're looking at that 3 to 5-year strategic plan to really start getting that momentum that we've at least sort of maintained and build that out further. Penny, how do you feel about strategic plans?
Well, I think it can be very intimidating because the first time I heard strategic plan, I thought, oh, that's something I don't handle. So I think you can think of it as goals. Where do you want to be? What is your vision for the next couple of years? Even if there's not a huge strategic plan, because that probably takes, more people on the team to facilitate. But having goals and steps to get there, I think is a lot of what strategic planning is. So, because it can be pretty overwhelming overall. So anyway, it can be a smaller piece of the bigger picture if you're not quite there yet. So
for sure. And I think it's a lot like curriculum design or anything else, where we want to be able to put ourselves in the context of the bigger picture. That's going to help us justify the work we're doing. So if you're operating as an operations specialist and you put together your goals, I would like this to be what happens over the next 5 years. This is a need I've noticed, and this is how I'd like to solve it. And that need can then be placed into the greater goals and objectives of your department. And then that can be placed in the greater goals and objective of your organization. And often when we talk about, as we get kind of into those bigger levels, you may be aligning yourself with the quality department. You may be aligning yourself with educational goals for the institution, patient safety goals for the institution, risk management goals, or even just aligning yourself with the mission and vision of your department or of the institution is just going to make it so it's a lot easier for you to justify the work that you need to do and to be able to get where you want. I love being part of a data-driven organization. I love that we can say we need X number of dollars to perform this thing X number of times, and it will offset patient falls or whatever it happens to be. But at the same time, I also know that telling stories is going to get me a lot further. And if I can take my goals and objectives for myself or my department and place those in a story that the institution really cares about and align it with those goals, I'm going to get a lot further. John, you popped off. Do you have something to add?
Yes, if I may.
Yes, please.
I hate to interrupt, but you're talking about something that I feel very passionately about. My history also is in building simulation programs as an end user, right? So I was a customer for many years before I came to Laerdal. And what you're talking about and Penny's comments regarding that this should be goal oriented. Sometimes building a strategic plan or a business plan can really appear to be very overwhelming and not quite sure exactly how to move forward because that isn't our strength. But having said that, the reason that I think that this is such an important topic is because it allows you to use your plan to make an argument to your administrators for why you need the resources that you need, right? So being able to compete for the institutional resources that are out there, and they're out there, you need to be able to have a plan to put in place in front of your administrators to be able to make that argument. And it's just something that I really feel very passionately about. We saw this time and time again in some of the colleges that we were working with as well. So Matt, I think you're totally onto something there and could not agree with you more. On that, I'll go quiet again.
No, that's awesome. I appreciate it. Thank you for offering that. I think the other thing that I would put out there, just one other piece to Criterion, one that has become near and dear to my heart, is if you're looking at this from the other direction, if you're an administrator, and whether it's that you're putting together a strategic plan or you're looking at a strategic plan, I don't know that I say his last name right, but Patrick Lencioni, the guy who wrote The 5 Dysfunctions of a Team, he wrote a bunch of other books. And one of the books that he wrote was The 3 Signs of a Miserable Job. And it's a terribly named book because all it is 3 things that you should be providing to every person on your team to help keep them motivated and engaged, right? And one of the most important things is that people be able to contextualize their role in the work that's happening in the organization. And us as simulation and us as education often end up in these kind of far corners of healthcare where we know instinctively, we know ideologically that we're contributing in really meaningful ways to patient outcomes, to healthcare delivery and all of that. What a strategic plan can do, though, is it can provide that pathway and make it super clear. So now you're an administrative assistant, you're a whatever, you know that this work that you do contributes to this thing. And here is the path that connects you directly to the things that the institution has seen as an important thing. That can help us get through a lot of tough times. And particularly looking at the last few years where things have been rough for a lot of folks, being able to see exactly how your work is impacting the institution or can impact the institution can be really valuable for keeping people engaged, employed, and totally switched on. Next slide. So criterion 2. To Augustin, to your point, providing personnel with appropriate expertise. Now, this one is interesting to me because I've seen it implemented 2 different ways. One of them is talking about providing personnel, and one of them is talking about providing appropriate expertise to your personnel. So one is to say you need the right people sitting at the table, which is totally correct. And when we talk about design or we talk about running programs, a lot of times we'll see administrators administrate, educators educate, operations people operate, whatever it happens to be. But really, simulation has become this field that's so complex, and it's such its own body of knowledge now, that we have to have all of those people at the table together to be able to adequately plan and carry out any simulation that we want to do. Now, in the facilitation standard, I believe we talk about how you really want to have one person focused on the operations and one person focused on the education. That's also about providing personnel. One of the things I like to look at it through, though, is more from that professional development perspective of we want to take the personnel we have and provide them with the appropriate expertise. So that's sending them to conferences, bringing them to webinars like this, being able to build up their skill set, and not just their skill set in the role that they're in specifically, but also whoever they're adjacent to. We want that little bit of overlap because that's going to help everybody to be able to communicate better. It's going to help us brainstorm better, and we're all going to be able to function much more appropriately and much more in a much greater capacity. We become force multipliers for each other because now we're really getting into the nuts and bolts of it, but everybody is stepping to the table with their individual expertise to create that one better thing.
And I think,
Penni.
Matt, in talking about this, I didn't mean to interrupt you. I think so many people, and we're in the same way, and I know, I'm sure at the VAs around the country, you need more people. And this actually will support your journey or quest to vie for having people with a certain expertise that is not just, oh, throw a mannequin in a room. So I think this is a great criterion that can go be useful when you're trying to go to your manager or supervisors. Hey, we need a few more people, and who do we need? Or getting training for those people that's, you know, the type of training that they need. So anyway, sorry.
Yeah. And that's Penny, I think that's such a good point. And when you then think about bringing all those people together when you're planning things. So when you're doing curriculum design or event design and development for something, to have particularly the operations people at the table, who often are not, but mix them with the educators, the administrators, management, whatever other pieces you have, so that now you can say, oh, you have 200 learners and you're giving us 4 hours of time. You know, here's the 3 pieces that make that puzzle. One of them has to give way and be increased significantly in order for us to get there. Or you want to do this thing. This is really interesting. I love that you found this mannequin in this closet, but before we can start using that mannequin, we need to train people on how to use it. And we need to talk about how we're going to scale that. Do we need more operations people to do it? Do we need more educators? Do we need to think differently about how we're training those people in that overlap, right? When we look at where operations and education meet, there's a lot of different ways that can go, right? I've been to some centers where the operations folks support everything. They do a lot of deep technical work and that kind of thing, but the educators, they run their own mannequins. And then I've been other places where they're like, absolutely not. No one is allowed to touch this mannequin except the operations person who knows exactly how to treat it and treat it right and all those things. And neither one is necessarily wrong. But then it gives you some ability to flex within that, to say, oh, person who's requesting this, if you want X, Y, or Z, we need this. We need more professional development. We need more people. We need more mannequins. We need this stuff. Mixing that then with your strategic plan, now you're able to talk about having those more people and having the resources to be able to support all of that stuff. John, Helen, anything you guys would add to that?
No, not for me.
The only thing I would add, I like where you went with it, Matt. The only thing I would add with it is in the organizations where I was involved as a customer, our goal was to create a customer service model for our internal customers. We called it the McDonald's model. And we wanted our Big Mac to taste the same no matter who was delivering it, right? And so our goal, our strategic plan was centered on how do we create the organizational infrastructure internally as a department that our simulation program needs to be able to allow our end users, right, the educators, to have the resources that they need to meet their learners' needs on any level, right? Whatever level. So we had some educators, to your point, that were all about running the mannequin, and we're highly competent at doing so. We had others that embraced technology at a very low level, but they were great educators, right? So they didn't want to touch the mannequin, but they wanted to use it to teach with, right? And so our customer service model was designed to be able to meet our internal customers' needs on any level of the scale. And that was something that we found to be terrifically beneficial.
Yeah, that's awesome.
For the customers.
And I think that's such an important point too, is I know I've gotten a lot of additional leeway at my current institution, because when I finally get to the point where I say, I need another person, or I need to send these people to do this thing, there is no question that we have exhausted every other thought process on how we might be able to solve that problem. And so if I'm asking for something more, it is because we need that additional person. We need that extra expertise. They need to do something that can't be done in another way. And a current example that we're dealing with right now, our program indirectly supports an SP program. Our SP needs as a hospital are pretty modest, but we also are contracted with a medical school, and they use a lot of SPs. And so we've supported their SP program kind of on a shoestring budget. It's been a bullet point. Like the entire program has been a bullet point in someone else's job description, which for those of you who do much with SPs, you understand an SP program just is, it's a large undertaking, and it's very different than mannequin-based simulation. And so the first solution that was suggested was, well, great, why don't you just add that to the operations specialist job description? And I thought, that's a wonderful idea, but A, they're already 95% tasked, and B, SP work is just different, and we could send them to some sort of professional development program. We could try and grow someone in that direction, but we're growing them in a totally different direction than what they currently do. And so we need to think about that. So between volume of work and type of work, this really needs to be a whole separate person that is doing very different work. Thank you, Helen. I appreciate that. Sometimes I get caught in my own jargon. Any questions about Criterion 2 or anything anyone's struggling with specifically? We can go to the next slide, but we can come back to it later if anybody has more. So for Criterion 3, we talk about developing plans to manage space, equipment, and personnel resources. Now, that may sound like a strategic plan in a lot of respects, but the plans to manage these different things, those are what support the strategic plan. So the strategic plan is that kind of high level overview. These are the big things we want to accomplish in the next X amount of time. And then this is more of the, like, this is the day-to-day, how we're going to meet that need. And in particular, when we talk about this for sim programs, as they get more and more complex, you start to have more complex space and more complex equipment and just more equipment. And now you've got demands on your time. Your personnel are having to run all over the place and set up and tear down and move these bits around. If you don't have plans in place, you're going to start dropping things. And so this is one of the ones that I think is pretty easy. People typically grow, their program, their management plans grow with their programs. But if you get dropped into a big program, or you come into a program that's been struggling, all of a sudden now you've got to develop those plans. And particularly for those of you who, I suspect, my limited experience with the VA is that there's a lot of one-person shops out there. Those plans tend to be things that you have to take care of it. You're the one person. So the plans are a little bit easier to kind of function through. But as you start asking for those additional resources, as you start growing things, you have to have a clear plan on how all those pieces fit together. So between Criterion 1, 2, and 3, all of those things are going to lean on each other to help you justify those additional resources that you need to be able to get additional stuff. Now, it's easy to say, right? Everyone says, well, I only have one room, I need another room. But if you have 2 rooms and 1 person, okay, you have to have a plan and you have to have a strategic vision for how you're going to manage that. Or if you have 3 rooms and 5 mannequins, or 3 rooms and 2 mannequins, right? Those are all going to take different plans on how you're going to manage those things and put those pieces together. When we look at, we'll talk about some resources later. There's lots of different things out there for policies and procedures. And we'll talk about that in criterion 6 as well. But when we put together these plans for management, that's just helping you grow that program, and it's giving you those steps so that then it's not all of a sudden either you're adding another person, you're leaving and nobody knows what to do, or you want to grow, but now you don't have an ability to hand off what you did before so you can move into what you're doing. Penny, anything you'd add to that?
No, I was interested. I was actually, John just put something in the chat. I hope we hear from some people, because I used to be a one-man shop, and this is very, very overwhelming for someone that struggles with Excel spreadsheets and trying to get things done. And I think this is, again, something that can support people in their quest to maybe have resources that can help them manage equipment and getting the right people in the space, because it's a lot on one. And I was a one person in a TA for many years in a closet. We had a closet up until about 5 years ago. For about 10 years, I did sim in a closet. So it's important. And I think it's good to know that you're not alone in doing this. Sim community is always open. We're always here to, to help. And I've relied on the community to help with, any questions. So did we get anybody back to answer your question, John?
Not yet. Just for anybody that didn't see the question in the chat, I was asking for a show of hands, how many are running a one-person shop today out of the folks on the call?
Hey, John, I think your question just went straight to the host and the panelist.
Gotcha.
So maybe some attendees haven't seen it.
Yep. So a couple people are one person.
Oh, and Matt, you have a question in the chat if you want to.
Yeah. So yeah, I mean, right, space people or equipment. One of those 3 things will always be your challenge. And I think in terms of space, it depends what your challenge is with space. So in my center, when I got here, we had a longstanding rule in the department that essentially almost all sim happened in the sim center. And it was a safety question, and it was related to how we managed our supplies and all that kind of stuff. But we're a 6-room, fundamentally a 6 immersive room sim center. That space fills up in a hurry. You have more than a couple of events, and now we're full up. And so then you add setup and teardown time plus the event time, and we can't accommodate much. And so we had a couple of things that we looked at. We looked at, number one, how much can we do in situ? Do we have the option to move into the health out into the system and support them there? We also looked at unconventional spaces for different kinds of training. So when we thought about part of our planning process is to consider the primary fidelity and the necessary fidelity for the simulation. So sometimes you want your fidelity to the task or your conceptual fidelity to be your number one thing. You want the actions that they're doing to more accurately represent what they will do on human patients in the future. Other times you need full environmental fidelity. You need that buy-in, you need that immersion. And what we found a lot of trainings where we were doing full environmental immersion, 2.5 hour setups for these intense critical care scenarios and all this stuff. And then when we watched the training and looked at the actual objectives, it was super intense, super immersive, full scenario written out. But the objective for the scenario was actually to walk in and start a Foley catheter on a male patient. That's a whole lot of work for this one little thing, no pun intended. And so instead, for those, we were able to then change it to say, hey, you know what, for these trainings, we're going to move this into this conference room we have in this debriefing room. We're not going to take up the sim space. We're going to use task trainers, and we're going to let you practice the skill. Now, if you need to then later incorporate making the decision to start a Foley catheter, or you want it to be part of a scenario, let's talk about it, and we'll come up with different ways to do that. But it gave us that opportunity to navigate that and rethink how we used our space. Same thing with staff. So the next thing we did was we started running out of staff because we had our staff running around doing setups. They were running the mannequins. They were doing all this stuff. So then we reevaluated our tech needed events, which is what we call anything that predictably enough needs a tech, to say, rather than it being anytime a mannequin is used, a tech is required. Instead, we said, all right, here's some additional training you can do if you want to operate your own mannequins. And then during our development process, one of the questions we specifically ask is to say, how intense is this training? Is this something where you need one person running the mannequin and one person watching the learners? Or is it something where you're going to interact with the mannequin 3 times to change vital signs and you'll be able to pay attention to the learners the whole time? Is it something that's super algorithmic like ACLS, where you don't have to do a lot with the technology to make it work? And so by navigating that, we were able to kind of dance that dance. But I think, kind of to Penny's point on the last criterion as well, there are a million different solutions to almost any problem that you have. You probably have some great ideas that you want to implement. That's super important. The community of simulation experts out in the world also has a million different solutions for the same problems. I went to one center where space was a premium for them. They just didn't have a lot of floor space. What they did have, really, though, oddly enough, was super high ceilings. So their mannequins, terrifyingly enough, particularly the older and lower fidelity ones, were strapped onto backboards as though they were in a high angle rescue and hoisted up to the ceiling, which felt a lot like a terrifying vampire movie, but it maximized their use of space, and they were able to navigate that and have the rest of that space that they needed to do the work they needed. Does that answer your question a little bit, Marianne? Awesome. So next slide, please. So criterion 4 is secure and manage financial resources. Now, this is such a funny criterion to me because it's just sort of like floated out there, like it's just, yeah, easy enough, no problem. To me, this is less about actual money and more about knowing the pathways that you have. So I've had the opportunity to be director of simulation in one capacity or another for 3 really different institutions. And one of them, we had all of our stuff was under a construction budget. We got millions of dollars worth of equipment from the beginning. And there was no pathway for me to be able to get supplies that we needed. Like, I needed gloves, and they said, well, we don't actually know how you're going to buy those. That's just not a thing we can do. We needed IV start kits, and they were like, we don't know even how we'd start that, right? So we hadn't secured the pathways to that, and we didn't have a budget to be able to navigate those things. And I talked to a lot of folks who say, well, I don't have a budget. You exist under a department that somewhere along the line definitely has a budget. So it's knowing how to access those things. At another one of my institutions, we did not have a capital process. We had to go through a foundation to be able to get money. So we had to put together a very different request for capital for large budget items. But for small budget items, anything under, I think, $3,000, we didn't have a budget for it. We just got it. We didn't have to ask. We didn't have to do anything. We just put it on a credit card and it appeared and off we went. On my current institution, we have grant processes. We have something kind of equivalent to a foundation process. We have capital equipment processes. We have capital equipment non-institution funding. And then we have our operational budget that also has some weird twists and turns to it. It's super complicated, but I can say that I can secure funding for what I need. And I know what parts of this I manage. So when I was first putting together my budget for this, it was daunting because it was much more in depth than anything I'd ever done before. Once I understood which things I actually managed and controlled. So for instance, we technically on paper get billed for our space. That money already exists in the facilities budget for the greater institution. So the money that's required for that just gets put into my budget and it's just there. It's an accounting thing. So at first I thought, oh my gosh, I have to manage that. I've never managed large institution space budgets before. That's a lot. I don't have to manage that. I do, however, have to understand what's in each of my line items, where I pull from, and how that works. I have to understand how I work with my finance department to be able to navigate those things. And advocating for yourself to say, this is what I need, this is what I want in the line item, this is, you know, what the line item is called, or this is what you allow the line item to be called, and this is what's in it, becomes really important. And just being able to navigate that and speak that language, because even if you don't control your own budget, to be able to speak to your administrator, to speak to whoever's above you or whoever runs your budget, to say, oh, this is something that would fall under capital, so we need to go down that process. How do I support that? Or this is definitely not capital. Do we have money in our budget to be able to support this? Can be a really important conversation. Penny, how do you feel about securing and managing financial resources?
Well, I was not an MBA back in my day. I'm still not an MBA. And as a nurse, which most of us sometimes are being thrust into this, you're not, Matt, I know it. But this is the hard part of it. I would bargain and go beg for supplies or donations. And so I did that for a long time. And as we built the work, you know, you build it, they come. The more people use, more people are willing to help with that. But also, I think leadership and administration will see the impact and the outcomes of what you're doing. And I think that's a big piece is finances sometimes are driven by the data and keeping up with that data. You may talk about that in a minute, Matt. This is a really big piece of it because now we have a budget. I don't have to go beg for stuff, but it took 17 years, well, not quite that long, to really get to that point. But it took a lot of work and a lot of, you know, and having this standard, I didn't have this where I could just say, hey, here's some evidence here related to the needs in this, and I need some help with it. So no, yeah, right on. This is a really hard thing for people. So, and sometimes you're given what you're given, and then you have to figure it out.
Yeah. And I think that's the.
I'd like to jump in for just 1 second because this is VA specific. The VA has a very, very unique purchase process.
No,
right?
I know.
It is many, many layers deep, and it is a long cycle to get from conception to actual equipment showing up. Having said that, it is not any different in the VA environment in that you need to go and secure resources to be able to buy the things that you need to buy or to get the space that you need to get. And it is like any other institution in that you have to be able to be prepared to show that argument, right? Show what the return on investment is going to be if I can get X, whatever it is you're trying to get, whether it's personnel, space, or equipment. You know, in the VA, you should not have to recreate the wheel in simulation. There are resources out there. We have people that share their proposals, that share the pathways that they have chosen to get to funding and have been successful with it. There are a lot of resources that we can help with. And this is not about selling simulation equipment. This is about us helping the simulation program in the VA like any other simulation group, right? It helps us with our mission of helping to save lives. So take that for what it's worth, but you're not working in a silo. Others have traveled this path. There is evidence to support you every step of the way. And if you need guidance on how to get to it, please let any of us know, and we will help you. It's free.
This was one of the hardest things I had to do. And it's scary. If you're not a numbers person, you're a life-saving person. It's scary to go talk to someone and say, hey, I need some money, you know, and having support to frame it, that can be scary. So I think you're right, John. There's a lot of resources and people that, you know, can help because I needed a lot of help. I still do. I have a finance person now that helps me every day, thank goodness, but I didn't back in the day. So
it's learning how to speak the speak of the bean counters. You know, we can go in saying learning objectives left and right, and here's what we're going to change to affect the organization. But the bean counter is like, well, how much money is this going to save? Gosh, I don't know.
For sure.
You know, so it is a whole process, but
Yeah.
yeah, not one that's insurmountable.
This is, I mean, this is big enough that we're writing an entire course just on this for a couple of different master's programs. So we could go on this for hours. Let's go to criterion 5. So use a formal process for effective systems integration. Now, this is something that a lot of people, I think, misinterpret a lot of the time, and they think systems integration is interprofessional education. When we talk about systems integration, it's actually using SIM for more than just education. It's saying, okay, SIM is a great education modality, but you know what else SIM is? SIM is also a great way to test your policy, to test your procedure, to test out a new space, to do all these things. And when we talk about wanting a formal process for it, it's that SIM should be fully integrated. It shouldn't just be the quality department did this work, they've thought about this thing, and now they want SIM to do this other part and then train everybody how to do it. Instead, it should be SIM is at the table to help them determine how they want to test it, how they want to set it up initially, what's going to work or not work, gives feedback to them, to the people that are designing the space or creating the procedure. And then in SIM, they test it out some more and they kind of work through a PDSA cycle, plan, do, study, act cycle, or whatever method you use, SWOT analysis, that kind of thing. And then continues through education. And then even in education, they provide that feedback back. And that way, then you create this loop where you're fully integrated. And I think for those of you, for all of you in the VA, you're working in a health system. And Penny, to your point, getting on the safety committee is awesome. Resuscitation committee is great. We have a patient safety committee, quality. We have a thing called the Value Institute that is just for this kind of work. We work with risk management a lot, and all those things can help you, again, tie yourself to that bigger mission. They can connect you to better and bigger resources, and they can help justify that return on investment in some really meaningful ways that aren't just education, but actually integrated into the health system. Penny, anything you'd add to that?
No, it just be at the table if you can and get in those conversations.
Yeah, it's a super interesting thing to do, and it's definitely a space where you get into the less squishy side of SIM and things get really deep and really interesting really quick. We can go to criterion 6, Helen, if you don't mind. So criterion 6, as I mentioned before, creating policies and procedures to support and sustain the simulation-based education program. At the end of the day, we can't really understand what we do. We can't reliably repeat what we do, like John was talking about early on, of trying to create that same experience for everyone every single time. We need those policies and procedures in place. 1, so that we do it right and the same every time. 2, so that we know what we're doing and why we do it, and we have something to lean on when someone wants to push outside of that. When they want to push outside of it, it might mean we need to change our policy and procedure, or it might mean that we need to really back up to that policy and procedure and hold strong to it. And this is one of the things that I think, Penny, for me, budgeting was less daunting to me than policies and procedures. They were overwhelming, because some of the stuff you have to have policies and procedures for gets weird quick. Learning about the various audio recording and video recording policies and state laws is not a thing I would expect to have to learn about in my simulation career. But all of a sudden, you're wandering down that path, knowing what consenting has to look like for a research project, all those different things. But the best thing is there's so many resources out there for you. There's a community to lean on to ask questions to. Defining Excellence in Simulation Programs has a great chapter on policies and procedures. So far, I think at every conference I've ever been to, I've found at least one person who mentions their policy and procedure manual, and I just ask them to send it to me, because every time I look at one of those, I find a better way to do it than how I did it before. And especially, I come from a whole line of medical malpractice attorneys. They terrify me all the time about all the things that I could possibly get sued for. I think they're overreacting, but it makes me very diligent about making sure that I have a policy that someone else has agreed to that backs me up on pretty much everything I do. Penny, what has your experience with policies and procedures been like?
It's taken us a long time to get ours. Like we're finally getting a really good set now. Like it's really hard, and you have to work within the framework of your institution. So often we don't call ours policies because that's a bad word somewhere. We call them standard operating procedures, especially if it's how we do things or our expectations. So it is hard and it is very daunting because we took on everything. And I think it's important to start with just some small processes, and you can build on that to really develop. And I know the accreditation standards have some good guidelines or examples all over the web that can kind of help with that. But yeah, this wasn't quite as daunting as the money. So yeah.
So those are the 6 criterion that we use for the operation standard. And it's a super quick overview, but we did want to leave some time to talk about some additional resources and to give you guys time to ask us any questions you might have. Now you're on the spot. You're all part of this now.
So Matt, while we're waiting for somebody to jump in here, I like where you're going with the policies and procedures, or the standard operating procedures. Again, in the VA, no need to reinvent the wheel. There are plenty of them out there. I like your concept of looking at every one you can find to figure out where you can hone yours to make it even better. I agree with that. I think we all have room for improvement in everything that we do. The other piece of it is this is also a good opportunity to involve a SIM committee because collectively we're a lot smarter than we are individually. And if you're joining these other committees, risk management and patient safety as an example, invite them to join your simulation committee. Give them a seat at the table and a voice in the process, because then they share ownership and they share that collaborative experience. So now you have interdepartments, an interdepartmental organization that is working to truly better care at the bedside. And everybody has a stake in that process and a voice in it and what it looks like. One of the greatest things that I think can exist for any sim program is a simulation committee where everybody has a voice. But the policies and procedures is a good place to do.
All right.
Thank you, Augustine.
Yes, thank you for joining us. Okay, well, you know what? While we wait for more questions to come in, we will actually move to our poll, which we actually, I don't know if a lot of you joined our last webinar that we did, but we want to hear from you. If you're not aware that this is actually a webinar series that we do on a pretty regular basis, we try to do it every quarter, and we love polling our audience to see exactly like what you're interested in learning about so that we can tailor these webinars to your needs. You know, we want to make sure that they're valuable for you and that you're really learning and taking something away that you can actually implement. So a poll just populated here. So hopefully you guys can all see it. And we have all of the standards listed there. So if you're interested in learning more about one specific standard, just, you know, drop it in there and then we'll focus on that for the next webinar that we do.
Can everybody see the poll?
Can you guys see the poll? John, can you see it?
I cannot, but
Oh, okay.
It didn't pop up for me either.
Oh boy. All right, let's do this again. Sorry about that, guys.
There
Clearly
you
Zoom
go.
is not my thing.
there we
All
go.
right. Yes. Tell us how you feel, guys. Let us know what you want to hear.
Penny, which one were you the primary author on? Which ones?
Penny had she had a meeting with.
Oh, she popped off.
She had to drop off the call.
Rats. I was going to try and nominate whatever one she did as the next
Throw
one.
it back over.
My goal.
On our last webinar, actually, we did have a few questions about interprofessional education and debriefing as well. So those, I think, John, we might have to maybe focus on that, and sim design too. I think that's a good one as well. So what do you say, John? Do we,
I would probably lean towards either simulation design or debriefing would be the next one that I would focus on.
okay. Yeah, and we'll get to all of them. Like I said, these are, this is a series that we're doing, and we've already done one, and we want to do it every quarter. So, and even if you can't join, you can always sign up for the webinar, and then we'll send you the recording after. And it's just a good extra tool in your toolbox to be able to utilize and implement into your program. So, okay. I will get that out of the way. And then a couple of things, we just wanted to share some resources with you all. So if you don't know where to access the healthcare simulation standards of best practice, you can do that by scanning this QR code. That'll take you to a Naxal's page, and it'll give you the short version of that, and there's a link there to take you to the longer version. So, so feel free to do that if you want to scan that. And then on our last webinar, we actually got a lot of great questions about additional resources. So we wanted to just take a minute to just share this. I know everyone is always interested in continuous learning. So a few books that Matt and Dr. Watts actually suggested are Defining Excellence in Simulation Programs, Operations Technology and Innovative Practice by Scott Crawford, and Improving Healthcare Systems by Ellen Deutsch, if I'm saying that right. And then Comprehensive Healthcare series, which is an entire series by the Springer publishers. So those are just a few books. If you have your own books that you want to share with everyone, drop it in the chat so that everyone can see that as well. And then some conferences that we recommend, even Laerdal participates in majority of these conferences. IMSH, which is happening, I think, January 20th through maybe the 24th of next year in San Diego. That one's a great conference for you to go and learn. And I believe they provide continuing credits as well. And Naxal's another really good conference. It's usually in June. NLN is one that is outstanding as well. That's in September, I believe. And then Laerdal, if you don't know, I've seen a couple of people on the webinar that actually were just at our Sun conference in Orlando a couple of weeks ago. But if you aren't familiar with our Sun conference, it's actually a really awesome conference. We're doing it in Vegas next year at the end of October. And if you want more information, just reach out to me and let me know, and I'll get that to you. But it's a great conference. We're always looking for speakers too. So if you feel like you want to be a speaker and can share some value there, just let me know. And then we also have two operation-focused conferences. One is SimOps and the other is SimGhost. So those are both excellent conferences to attend as well. Just one last resource page that we want to share are some publications. So Simulation in Healthcare has a journal and an online newsletter that you can subscribe to. And then SSH has a new publication called Storm, which is the Simulation Technician and Operation Resources magazine. It's online. It's a great resource. I was actually skimming through it yesterday. I think there's been 2 volumes that have been dropped so far. And then Naxal has their Clinical Simulation and Nursing Journal as well, which is a great publication too. And last, there is a podcast that we want to share on here. It's called Sim Geeks, which is super operations focused, but it's a great podcast for you to be able to go and learn new tips and tricks on how to navigate through operations in a sim center. So the last slide that we have here is if you do have any questions for us, I believe most of you have my contact information, but if not, you can I'll send that over to you once I send the recording. And then John Gillespie, actually, he has shared his info here. So take a picture of it, save his email address, reach out to him via phone. Any questions you have about VA focused sim or any questions at all, John can definitely answer that. And if he can't, he'll put you in contact with the experts who can. And then just the one last thing, I just wanted to share, in case you are looking for any information about Laerdal products, we do have a really very nice long line of products and solutions that we offer. And one thing that a lot of people ask us about is the nursing and simulator geriatric. So I figured we'd add a QR code here for that. But if you want, you can just go to our website, which is laerdal.com, and poke around there. But any questions at all, feel free to reach out to myself or John, and we will get that answered for you. So I know we are a couple minutes over, and I know we've already lost Dr. Watts, but any last words from Matt or from John?
Matt?
I just appreciate you all being here. I think the work that you all are doing is incredibly difficult, and I know what it can be to feel a little lost and a little alone. Just know that the rest of that community is out there, and reach out anytime. Feel free to find me on LinkedIn or whatever. I'm out in the universe someplace. And definitely, if you're at any of those conferences and I happen to be there, swing by, say hey, and let's talk.
Matt and Dr. Watts, thank you both for supporting this incredibly important webinar. I've always felt passionate about operations, and I'm tickled pink that we got to do this. So thank you both. I really am very appreciative. And of course, Helen, we couldn't have done this without you. So thank you.
Thank you both for having us.
Of course, it was our pleasure. And thank you for sharing all this great knowledge. And thanks to our audience as well for joining us. And I will actually do you guys one favor. Instead of searching for Matt, I will give you his information myself. So I'll put it in the email that I send out with the recording as well. But feel free to reach out with any questions. Thank you all for joining us. Have a great afternoon, and look forward to our next invite, which will be our webinar will be in February, I think is what we decided. So keep a lookout for that invite. We'll be sending it out really soon. All right. Have a great afternoon. Take care, everyone. Thank you.
Thank you.